So for the comprehensive physical exam, that is commercial payers and Medicaid, what we are looking for, so if somebody calls up and says, I want to schedule this, what does the front desk do? What are the responsibilities when somebody has this, when we're coding this patient appointment? Same thing for medical assistants. And then providers, what do you do during comprehensive physical exams?
Okay.
Sound good?
It's one item per sticky.
Yes, sorry. Thank you.
Hi, I'd like to make an appointment for a physical.
No, but I don't understand.
No, we don't take new patients. Goodbye.
You just say what I do during a comprehensive physical exam, and I can only write one thing.
One per
Yes,
sticky.
one per sticky. So
You
you
have
may
20
have,
stickies if
yeah,
you
you may
want.
have 20 stickies up there, which I will happily.
Trees are going to die.
It's all in the name of education.
I see. Unless I just
But
write comprehensive physical
complete
exams.
physical examination
And if
is not something that's gonna go over there. Because we don't do a complete physical over there. That's
No.
one sticky.
On the annual, no, but I mean on a comprehensive physical.
Gotta do a complete, yeah, don't write down your last. Just write complete physical exam.
so, then will you explain that to those of us that don't know what's in a complete physical
Yeah,
exam?
so Medicare doesn't require, I mean, we're skipping ahead here, but Medicare doesn't require a complete physical exam.
Yeah.
And there has never been a definition of a complete physical exam. Dr. Stambuck takes about 35 minutes to do the neurologic portion of his exam. We surely are not going to take 35 minutes on that. A realistic annual physical exam for these commercial guys is not defined and has no scientific value, but we won't go there.
Are there things that you do as a provider that are the same in each physical? Okay. Those are the things I like for people that are not clinical that may
Yeah.
be of help
So we
to.
look in the eyes and the ears and the nose and the throat and the neck and the heart and the back and the chest and the belly and the legs.
It's like 10 Post-its right there.
It's one post-it. It's a complete physical exam because it is not.
Do you do that during your wellness visit?
A lot of time on this, and the reason is because
know
this
that.
has been around since you guys have been in practice. I think on this, this came around in 2010, and I think that we haven't focused so much educational wise on this. And so I think Antoinette's role is kind of the same on both. So Antoinette's role on this is that she checks when the last physical was, because our rules are that she schedules them a year and a day so that we can ensure that they get covered. So when a patient calls in for a physical exam, she's triggered by that CPX visit type because they look the same to everybody. It's a CPX. So she looks to see when that last CPX was, then she makes sure that she schedules a year and a day, and then she looks for when your next 45-minute opening is, and then she sends out that letter letting a patient know that, and the letter states that a physical exam is usually covered by insurance, but if you talk about anything else in addition to a physical exam, that there might be copayment or deductible. That's what that letter says. And then Candy goes in and she does preload, and she goes in and she looks when their last physical exam is, and she looks to see, and Candy's going in and she's looking when their last mammo is, when their last colon is, when their last DEXA is, and then she's going in and she's going in and seeing if they're due for their fall screening and if they're due for their depression screening. She's going in, you didn't put this on here, but I know you're doing it if they're diabetic. You do
Oh,
the
diabetic templates,
You
yes.
do your diabetic template, you're ordering any applicable labs. And then when the patient gets here, she goes in and she
Wait.
does,
Who sends out the prostate?
Stephanie does.
Sorry, yeah.
Steph's not here.
Okay.
Sorry, that should go in the process there.
Yeah, she
I forgot
does.
about that process.
Shortchanging yourself.
Sorry,
And
forgot.
what was the other thing?
Diabetic,
Diabetic
templates, yeah.
Yeah. She screens the males for PSA. if they fall into the correct denominators. And then when they get here, she goes in and does vitals, and she goes in and does medication reconciliation. The doctors go in and do update meds. They go in and review social history, which includes exercise, cigarettes, alcohol, drugs. They go in and review their last mammogram, colonoscopy, vaccines, DEXA, PAP. They do a complete review of systems. They update their family history. They review their past medical history. They do a complete
Monster
physical exam. They give recommendations to improve their health. They go in and do labs, and they do pap smear. Okay.
Let me ask a clarifying question. On recommendations to improve health, does that look like somebody's diagnosed with
Big enough to
diabetes?
drive an 18-wheeler through.
Yeah.
So that's very dependent on the patient. If
Yeah.
they need vaccines, you give them vaccines. If they need a mammogram, tell them to get a mammogram. If they need a DEXA, tell them to get a DEXA. If they're due for a colonoscopy, tell them to do that. If they're, sitting on the couch all the time, I tell them to get their butt up and go exercise. So it's really dependent on the patient.
Okay.
That's why I left it that wide.
And there
Do
are-
patients, I'm sorry, go ahead.
There are some guys who, men and women, who come in and they've done their mammogram and their colonoscopy and they're biking, and you say, "You look great. Get out of my office. I'll
I
see you in a
say,
year."
keep up the great work, see you in a year.